Welcome to the show. I'm your host, Dr. Mike Wall. Well, cancer isn't just one disease, it's more than 100 diseases. And more than 200,000 Canadians will be diagnosed with cancer this year, in spite of the fact that 4 in 10 cancers are actually preventable. Understanding risk factors and making appropriate lifestyle changes is key. Now, a study conducted by Calgary researchers found that the top 5 preventable risk factors for cancer are smoking cigarettes, physical inactivity, excess weight, low fruit consumption, and sun exposure. And the most preventable cancer was cervical cancer, thanks largely to the HPV vaccine. Well, this week we welcome Dr. Sevtap Savash from the Division of Biomedical Sciences and the Faculty of Medicine at Memorial University for an important discussion on cancer rates in Newfoundland and the public interest group on cancer research. Now, this is a province-wide partnership between researchers, health professionals, and members of the public focused on the needs and priorities of cancer patients and their families. We're then going to be joined by Janine Taylor-Cutting. She's a counseling therapist, patient advocate, and a cancer survivor. She'll share her personal experience as a stage 3 cancer survivor, from diagnosis through treatment to post-discharge from the cancer care system. We'll learn that patients and their families are faced with sometimes overwhelming challenges and ongoing difficulties. We'll learn what her firsthand experiences taught her about the needs and priorities of cancer patients here in our province. With our province having the highest rates of cancer in Canada, this is an important show to share, even if it's a difficult subject. Let's check in with Dr. Savash and learn more. Hi, Dr. Savash. Welcome to the show.
Hi, Mike. How is everything?
It's good to see you. It's nice to see you in this setting instead of at the university where we work together. And why don't you tell everybody that's listening about what your role is at the university and what you research?
Okay, so I am currently a professor of genetics and oncology and biomedical sciences. I'm also cross-appointed discipline of oncology. My research is fully focused on the survival outcomes of cancer patients. So my overall aim is to, improve their condition and wellness. And we do, a variety of different research, as well as other activities like public engagement, advocacy, etc., to help do this and bring some sort of relief and hope and, wellness to our cancer patients and families, starting in Newfoundland and Labrador.
Well, that's right. And I mean, so there is a need here in the province for this. Like, what is the cancer rate in Newfoundland and Labrador compared to the rest of Canada?
Unfortunately, among all Canadian provinces, Newfoundland and Labrador has the highest cancer risk. So that means that just by being here, your risk of cancer or getting cancer increases. It's very interesting. It's worrisome. There is almost a gradient from west side of Canada towards east Canada. So other Atlantic Canadian provinces or Maritimes as well, for example, they also have higher risk, but ours is the highest. So every year, approximately 3,800 Newfoundlanders and Labradorians are diagnosed with cancer, and almost 1,800 of them die because of cancer. So these are significant impact, on these communities. Yeah.
Yeah, and I think about this, like, our health status, we have the highest rates of diabetes and obesity and heart disease and everything else. Does this sort of go hand in hand of why we have higher rates of cancer?
It's difficult to answer this question, but maybe they have some common causes, right? For example, when we think about why cancer risk increases, we think about risk factors, social determinants of health, and access to healthcare. For risk factors for cancer, for example, there are a number of well-known ones. For example, age. And we know that in Newfoundland and Labrador, we are an aging population. So as we age, our chances of accumulating this cellular genetic abnormalities increases. And this is one of the, the reason for developing tumors. So aging population, the demographics is important. And of course, certain lifestyle factors. It may be different from one person to other. For example, for lung cancer, right? We have, I think, Newfoundland and Labrador, as well as Quebec, has a relatively higher rate of smoking in the country. So that maybe that somehow, shows itself as a slight elevated risk for lung cancer in these provinces. Or life factors. For example, obesity you mentioned is somehow related to other cancers. For example, sometime I think it's linked to colorectal cancer as well as I think breast cancer. Yeah. So there may be some, common risk factors, but we should also talk about the social determinants of health, right? I mean, it's related to income, education, services available, opportunities available to individuals. And in Newfoundland and Labrador, we have a relatively huge rural population as well. Their economic opportunities, etc., are so limited when compared to urban areas. So that can show itself as a factor in why certain cancers are detected higher here, and it can also affect the survival chances of cancer patients as well.
Yes, that's right. I mean, I know the Health Accord NL has come out recently saying that's one of the big things, and Sister Elizabeth had been talking about that as well. So. Yeah. So when we're talking specifically about colorectal and stomach cancer, we have high rates of this as well, don't we, compared to the rest of Canada? Why do you think that we have these rates that are so high, and our mortality rate is also the highest, is it not?
Yeah, right. So overall, I think the risk of developing cancer as well as the risk of dying from cancer is highest in Newfoundland and Labrador compared to other provinces. This doesn't include the territories, by the way. Mm-hmm. And the mortality can be high because the incidence is high. In other words, there are more people being diagnosed with disease, and that can translate into, more people being die because of cancer. But we should also consider, as I said, like the aging population. When we talk about survival, we also think about, disease characteristics. Really important in cancer, how extensive is the disease at the time of diagnosis. We call this as, cancer stages. Early stages where the tumor is small, it can be cured by, if it's a solid tumor, like colorectal cancer. It can be cured by surgery. It can be removed from the body. But as it's remain in the body, the tumor grows, the spread of the parts of this is when it becomes a little bit more challenging to manage clinically, and survival rates really decreases dramatically. Mm-hmm. So this excessive healthcare and socioeconomic determinants of health, we really need to think about this, and the demographic of population, like aging population. We have to think about all of these. And colorectal cancer, not sure about stomach, but colorectal cancer risk is really modified by lifestyle factors, constipation, the foods they eat, and how much fiber we had in our diet and so on. Again, it's kind of related to socioeconomic determinants of health. I'm thinking all of this may be a contributing factor, but hopefully we will, continue to talk about this disease, because there are also ways that we can influence our risk of getting cancer. And I think your listeners would like to know this as well. So
yeah, well, that's right. I mean, you just said age, location, diet, because access to food is tough. And think about the northern communities, even harder. I was up in Nain recently this year, and it's so much harder up in places like that as well. And so, yes, those are a lot of risk factors we have. Tell us about your public interest group on cancer research and what the motivation was behind that project. It's amazing. Yeah.
Thank you. I'm so excited to talk about this group. So this was a dream came true, really, because I've been thinking about it for some time. It's a public researcher partnership. We are collaborating. We are partners. Currently, we have 3 researchers. This includes myself, Dr. Hala Chakari, and Dr. Cindy Witten. And they are both at MAN, and Cindy is actually at Eastern Health as well. So it's really good, kind of collaboration between MAN and Eastern Health. But we also, in addition to 3 of us, we have 12 cancer patients or family members from Newfoundland and Labrador. I think that is really a great group. So what was our motivation in creating this group? We wanted to, know more about patient and family perspectives. We wanted to partner with them so that from the beginning on, we can work together in identifying research questions, like what is their needs and priorities. We can't really know unless we are in their shoes, right? So we wanted to get, so we formed this partnership exactly for this purpose. Can we talk together? Can we work together? Can we identify needs, priorities, interests of cancer-affected individuals in the province? And then can we co-design research studies and public engagement activities? So this is exactly what we have done. And we are increasing in advocacy. But I think in terms of research, like we developed a research project together. It's under review right now. Hopefully it will be funded. And it's not something that we thought that would be population need, but they do need it. Based on our conversation, it becomes so apparent. And the other one is a public engagement idea. And I'm very excited to say that now it's funded as well. We are going to organize a free virtual public conference on cancer with the target audience being the public members to talk about patient perspectives, family perspectives, screening, and how to manage cancer better, and what are the support and other clinical services available to cancer patients and families in Newfoundland and Labrador. So I'm really looking forward to that. And the idea has been developed together with our public members in the group, and we are actively, working together to do this. So it's really very successful, very enthusiastic, very efficient group.
That was Dr. Sevtap Savash from the Division of Biomedical Sciences and the Faculty of Medicine at Memorial University. We'll be right back after the break. Welcome back. We're here with Dr. Sevtap Savash of the Division of Biomedical Sciences and the Faculty of Medicine at Memorial University. She's sharing important information on cancer rates in Newfoundland and Labrador and the Public Interest Group on Cancer Research. Let's get back to the interview. What are some of the things that you have learned or your group has learned from the consultation with the patients themselves and their families?
Okay, I learned a lot. As a matter of fact, like I have a meeting with them in 40 minutes now, and I can't wait because every time we meet with them, they are so generous to sharing their thoughts, and they are amazing people. So we learned last year, for example, in 2021, we learned that there were three main areas that cancer patients and families wanted us to do better. So, for example, they had concerns about accessibility, right? So we know that cancer care is mostly centralized. Most of the services like radiation, I think most of the chemotherapy and some of the surgeries particularly are done here. So that means our patients need to travel from other parts of the province to here. Mm-hmm. So that was like, it's an accessibility issue because it's crazy, time-wise and also out-of-pocket expenses. It's a financial. And on the other hand, someone is saying, just like myself, I can just, take a cab, go to Health Sciences Center. So mm-hmm. I understand that this is nothing related to our cancer care program, but we just need to hear about, our patients' perspective. So they wanted, equal access to services across the province. And I hear them. We hear them. I think we all empathize with them. And second thing that they had a lot of information is, for example, what is my disease about? Like what stage is it? What treatment? I think at one point they are given this information, but it can be so overwhelming. So they needed better resources for information. And also like what is a credible information, for example, if somebody has any questions about their insurance or other benefits or their future prognosis. So the time with their physician probably, an oncologist probably is limited. So they have a lot of questions about their own disease, their future treatment, other options for themselves and family members. So where do they go? Mm-hmm. Luckily there is a really great dedicated provincial cancer care program in this province. So they have a number of different programs, but the issue we detected was that many of our patients and families were not aware of them. Well, right. So there is this great dedicated team of individuals who are aiming to, support cancer patients and families, for example, through oncology social work, through nurse navigator program, but not everyone was aware of them. So we saw, how can we put this, make this connection better, because the services here, professionals are so dedicated. Yes. So, and patients and families. So that is really something that we really would like to work on.
Yeah.
And the third one was that our patients and families wanted to be empowered. Yes. Right. It looks like it looks like, they wanted to know more, resources, information, including their own information, but also they wanted other people to understand them better, like their changes. So cancer may or may not change you or your physical abilities. For example, at the workplace, some people may treat like nothing has changed, but maybe some things have changed, or other people may treat it like everything changed about you, make an assumption. So they wanted to be understood better.
Yeah.
And empower. So these are the three key things that we learned from our conversation last year.
That's interesting. So I guess through all this, you've been looking in a different place because you're a researcher. So you would typically be looking at lab. Now you've reached out to the public and you've consulted with people that your research will benefit directly. Yeah. What have you learned? Like what's the most important research that you think we need to pursue going forward in the scientific world?
So I can answer that in two different ways. The first one is really like general idea. We really need to include patients and families in our research from the beginning on. As I said, like the information is of our patients. This is not what we thought was the most important barrier here, but it turned out to be so, and it's very extensive. So we really need to address that. But we couldn't know that without involving the perspectives and experiences of our cancer patients and family members. So this is very important. Involve patients from beginning on. And we do, and they are acting as patient partners in our research proposals now, and hopefully, and with the public engagement project I mentioned, like the public conference on cancer, we work together. And this is designed fully based on their needs and the suggestions, because for me, maybe this virtual meeting is really easy, but is it really accessible? Like we really need to think about this, and we do get the tips from our public members like this. So in any way, in any health-related research, public engagement, I think it's really important to include the representative of the public and the patients. But for us, the immediate research this is a project that we designed together with our group, our patient and family members, and based on their needs is information needs. Again, as I said, they need at different times of their cancer trajectory, from diagnosis to survivorship. There is a need for a lot of different information. Maybe at the beginning it's about disease, but after a while it's about treatment options, and then maybe after that about recovery or the long term. So yeah, as I said, like the first main idea is that, we have to include the public, patients, families, whoever we are really trying to help through our research and other scholar activities. We really need to include them, because what we think is important for them is probably not the one that they think is important. So it's really important to have their recommendations, opinions, and so on. The other thing I can say is that, like for us, for example, our discussions created, like there are three different key points, right? The accessibility of, equity and accessibility of healthcare or cancer care, and then information needs and how do we meet them, and then, patient empowerment. So for us, for example, the one that we are right about pursuing right now is the information needs. We designed a study together. It's under review. Hopefully, if it's funded, and when it's funded, we really would like to do that, like get a more detailed knowledge about how the patient and family needs, and also have the opinion and perspective of the healthcare providers, because they are also a part of it. And then how can we really make it better by having, advisor committees, this and that? How can we really, is it, providing more booklets? Is it more, patient education materials, whatever that is. So this is the one that we really would like to work on right now.
That's exciting. Well, it sounds like you're lucky to have them and they're lucky to have you, before we clue up here. And it is exciting to hear about the changes that you're doing and you guys are trying to work together on. Any last advice you'd like to leave our listeners with?
Right. Maybe not an advice, but maybe this is what I can say. Like a lot of time we are really scared of cancer, right? And I understand why. I'm a resident of this province as well. And you may want to know that 45% of the Canadians will be diagnosed with cancer. This is a very common disease. If you are not diagnosed with it, your loved ones can be diagnosed with it. So it does affect all of us. I know we are scared of it. I know we don't want it. But you know what? There has been tremendous progress in treatment, diagnosis, screening, and so on. So you can actually, and preventive measures as well, like quitting smoking, having, healthier lifestyle if possible. You have the power to actually modify some of this or influence your risk of getting cancer. And if you're interested, please talk to your physicians, your doctors, about things that you can do and take advantage of early diagnosis. So sometimes whatever you do, you still get diagnosed with cancer, like in hereditary cases, right? Sometimes it's your genetics. But still, it doesn't have to be a death sentence. Early detection is really important. It really saves lives. So as I said, when it's in the beginning, when the tumor is small, it's really curable. So please think about this. Try to influence your own, risk, reduce it. Hopefully, talk to your, physicians, and take advantage of the services available to you.
That's great.
There is hope. There is hope.
That's great. And it's so nice to hear from you. It's so nice to hear about the amazing things you're doing and the new forms of collaboration that you're bringing into your research. So thank you so much for taking the time and joining us today.
Thank you, Mike. This is amazing. Thank you very much.
That was Dr. Sevtap Savash. When we come back, we'll talk with Janine Taylor-Cutting, counseling therapist, patient advocate, and cancer survivor. She'll share her personal experience as a stage 3 cancer survivor. We'll be right back after the break. Welcome back. We're here with Janine Taylor-Cutting, a counseling therapist, patient advocate, and cancer survivor. She's sharing her personal experience as a stage 3 cancer survivor. Let's hear her story. Hi, Janine. Welcome to the show.
Hi, Dr. Wall. Thanks for having me. It's great to be here.
Oh, it's so nice to have you here. It's nice to hear from somebody who's got lived experience, because that's the one that we can all relate to. Can you tell the folks listening a little bit about yourself and how you got involved with being an advocate for patients with cancer?
Yeah, sure. So I was diagnosed at age 42 with colorectal cancer, stage 3. My husband and I had 3 kids, busy school counselor, very healthy and active, so it wasn't expected at all. The only thing that I can say about that experience was that it was life-changing. Within a day, my whole life changed. So I started on about a year of treatments. I had radiation, surgery, chemotherapy. And during that year, I just really felt compelled to share my story. So I started a blog. It was called A Year of Weather, because in my my innocence at the time, I thought that it would all be over in a year. But anyway, A Year of Weather, I guess it was popular locally. A lot of people here shared it. I live in Grand Falls, Windsor, so I had a really supportive community around me. So through that blog, I was able to start advocating a little bit around different issues that were related to cancer treatment and the cancer experience. So I wrote about listening empathically to people who are going through difficult experiences like cancer treatment. And I wrote about the importance of hormone therapy for women who have ovarian failure for cancer treatment, and screening, and all of those various things. I wrote about mental health as well, and how cancer treatments affect it. So through that blog, I feel like that was kind of where I started this journey to get to where I am today, working with Sevtap on the public interest group. So anyway, after that, in my private practice as a counseling therapist, I started focusing on medical trauma. And another community member who was going through his own cancer experience reached out and said, maybe we should start a support group. So we did that. Yeah, and we ran that through the pandemic virtually. So that was a great experience. Mm-hmm. So that in a nutshell is how I spent the last 3 years, I guess.
Wow.
It's been a pretty crazy 3 years.
That's right. You've done a lot. And that's a perfect example of life gives you lemons. You make orange juice and make them wonder how you did it. Like, you've turned a very negative situation to something that's helped a tremendous amount of people. And, we're going to pick your brain on some of these things today that you think are some of the key things that people should listen to if they're listening to this and they're struggling with an early diagnosis of cancer. And so one of the things that you say is that early diagnosis for cancer gives you the highest rate of success for treatment and survival. So what are some reasons why people delay a cancer diagnosis?
Well, there's a lot of reasons, I think. One new one that we have right now is lack of access to regular screening and everything because of the COVID shutdowns. So that's a whole other conversation, I guess. In my experience, what delayed my diagnosis was a lack of knowledge. Mm-hmm. So I was, as a 42-year-old, the whole idea of colorectal cancer was not even in my realm of possibility. Mm-hmm. I started feeling sick and I was fatigued and I had pelvic pain and pressure. I was treating myself for hemorrhoids. Sorry if it's TMI, but I just thought, that's what that is at my age. I was aware of colon cancer screening because my parents were they were involved in getting their regular colonoscopies, but it didn't occur to me that it could happen to somebody my age. So, of course, that delayed me seeking help and talking to my doctor about my symptoms. I had a number of workups in other ways because I was feeling rotten. I had, a referral to see a gynecologist and a full workup there, and I had, I had found a lump in my breast, and I had an ultrasound But really, I was sick with a tumor in my rectum, and I really had no information available to me to think that could even be a possibility. So mm-hmm. I think information is the most important thing, and for people to understand what the symptoms and signs can be of various illnesses and cancers. And so since then, like on my Facebook and in my blog, I often talk about the symptoms, and I tell people, like, check your poo and go and get your colonoscopy. And lots of times people will reach out and tell me when they've had their colonoscopy or when they've had polyps removed. And that makes me really happy because I feel like if I had some of that information, things might have been a bit different for me. I might have been at stage 1 or 2 rather than stage 3 when I was diagnosed.
Yes, of course. And that's right. And health literacy is the reason we do the show, so that somebody listening, tuning in, just going for a drive can hear something that could potentially shift their entire focus for their health going forward. So, you've talked a little bit about the mental health side of things, but other than dealing with emotional strain of a cancer diagnosis, what are some of the key challenges that people face when they have cancer here in this province?
Well, there's a number of challenges, I think, that Newfoundlanders and Labradorians face. Right now, currently, there's a lack of access to certain resources and family doctors and different things. Also, our geographic challenges can be quite huge. I was living in Grand Falls, Windsor, like I said, and I had to travel to St. John's for my radiation and my surgery. Mm-hmm. And that was kind of tough for me at the time. I called Daffodil House and there was nothing available because my treatments happened fairly quickly after my diagnosis. And I think they were booked up for 6 or 8 weeks out at that point. Mm-hmm. Now, I was lucky because I had a brother in town. I probably would have ended up staying with him anyway, because he would have been like, what? You have to stay with me. But, just the back and forth, the exhaustion of the travel. I remember finishing my last radiation treatment, and that was on a Friday, and driving home to spend the weekend with my kids. And I was going back on Sunday to do my prep for my surgery, which was the next day. And I spent, weeks just going back and forth to St. John's, which on top of the mental toll of everything was tough. Mm-hmm. And then, when you think about people who maybe are in Labrador or in even more rural areas than what I was, that can get pretty tough. Yeah. And we have centers all around the province. Like, we have a cancer care center in Grand Falls, Windsor. So I did 6 months of chemo, and I was able to access it in my community, which I was really grateful for. If I had to run to Emerge because I spiked a fever, which happened a lot, yes, it wasn't so bad. But for people who are on the South Coast, it's a different story. So I think Telehealth can help with some of that, but
Totally.
sometimes we need physical care though, so that can be difficult.
Yeah, that's right. I mean, that is one of the things. We've got a lot of challenges here geographically. That comes up constantly. We talk about our medical services here. It's one of the values of living in Newfoundland is we can live remotely, but it also makes it hard to get medical care sometimes. Now, once a diagnosis is made, what resources did you avail of or that people can avail of in the public?
There's a lot of resources. The first and most important one, and if there's any doctors listening, give this to your patients when you diagnose them, because a friend of mine called me about, I don't know, a couple of days into this experience and said, here's a thing called a cancer patient navigator. It's a person you can call, and they're a nurse, and they will help you. So that's a huge resource that I took advantage of. And my cancer patient navigator helped me figure out what was going on, because I had no idea what a tumor board was, or how this plan was going to be hatched and what I needed to do first. So I was just sent home. I was diagnosed, okay, you have a tumor in your rectum. You're going to have treatments. You're going to have a permanent colostomy. Now go home. And I was just like, oh, okay. Yeah. I don't really know what's going to happen. So the cancer patient navigator led me through everything. She had access to my records, and she could check like my appointments and call doctors. So that's an amazing resource.
Yeah.
And I noticed the other day that on the cancer care page now for Eastern Health, that website, which is a good resource in and of itself, they have the cancer patient navigator information right on the front page now. Yes. So that's really great. Yeah.
Yeah, those types of tools are really important for people. Now, the other thing that's really important is you said you improved your health literacy as you went along. How important is self-advocating for your own health when it comes to dealing with physicians in the medical system?
I think it's really important for everybody, not just people with cancer. We all need to be able to go to the doctor and say, here's what my needs are. Here are my concerns. Here are some questions that I have. And I think we get confused sometimes, and we think that if we're advocating, we're being demanding. But I just try to think about it as communication, right? You're a member of this team. Your healthcare team is inclusive of yourself. And you have to go in and communicate with them. And that'll help them make the best decisions for your care. And it'll keep you, I guess, feeling more in control and less stressed, because you're able to walk out with your questions answered. So it's really important. And and it's really important too, that you bring somebody with you. You can have a family member or a friend with you most of the time anyway, to ask those questions if you're not feeling up to it yourself.
That's Janine Taylor-Cutting, counseling therapist and patient advocate and cancer survivor. She's sharing her personal experience as a stage 3 cancer survivor. We'll be right back after the break. Welcome back. We're here with Janine Taylor-Cutting, counseling therapist, patient advocate, and cancer survivor. She's sharing her personal experience as a stage 3 cancer survivor. Let's get back to the interview. So somebody like yourself, they go in to see a physician, they get given this crazy news that things are going to change in their life. It's just got to be overwhelming at that point. What advice would you give people when it comes to asking the questions, but also having support people that can help you navigate that when you might not be yourself, right?
Yeah, that's a really good question. And I think I have a really concrete answer. This is what really worked for me really well, was get a binder. Yeah. Every time you have a test, a scan, a scope, blood work, ask your doctor for a printout, put it in your binder. In between your appointments, and this could be you or it could be a caregiver or a loved one, write down concerns, symptoms, weird things that are happening. And as you're preparing to go to your next appointment, on a sheet of paper, write down your questions and any information you want to pass on to your doctor. And then when you go in and you put your binder down and you whip out your paper, well, then you're in charge. And the thing is that I haven't met a doctor yet that won't sit patiently while you ask those questions that you have and make your notes in the meeting. And I think like going in that way really prepares you to get the information that you need.
Yeah. Well, one of the things doctors do is take a history, and sometimes having a patient that's informed on themselves, give them the vital information is going to be really important for them too. When you're going through those situations, there's got to be physical and emotional stress. It's got to be compounded when you're going through treatments that are extremely hard on your body. And then given the pandemic on top of it, like there's a lot going on. Did you find the pandemic really impacted things, or the resources that were available specific to the pandemic that kind of made it a little bit better?
I think there's one word that sums up the torture that being a cancer patient is at times, and it's waiting. And the pandemic intensified that for so many people, right? Whether you're waiting for an MRI or CT or your next appointment, when you're sitting there thinking that you may be having a recurrence, or that your cancer, if you're still an active cancer patient, that your cancer may be growing, that is a mental load that I cannot even begin to describe. So yes, the COVID impacts were incredibly tough for people, because I'm just thinking of people, who need an urgent MRI. A couple of years ago, that might have happened within a week. And now it might be 4 or 5 or 6 weeks.
Yeah.
So, and that might be improving, and it probably is, right? But that's the biggest impact that I can see, is just that wait time. So when you're in a process of trying to heal, and then you have this like stress of waiting, it's really hard because you're hypervigilant, you're amped up, and it's hard for your body to heal when you're feeling that way.
And you found positive outlets, becoming an advocate, writing a blog, sharing, your history. And I think that's such a great way to try and ease some of that stress by knowing you're making a difference. Now, you said yourself, like you wrote a blog, it was going to be for a year. And then eventually, maybe within a year, you were discharged from the cancer care program, but that really isn't all it wrote, right? So what does that mean going forward for you now that you've been cleared and you're in remission?
I just have to address like that period of time after cancer treatment, after active treatment, because we don't really talk about it very much. And I've thought for a long time, what would I call that period of time? I don't know. I don't have a good name yet. For a while, I was calling it in the muck. I don't know. But when you're going through active treatment, you're in survival mode, and you have your milestones usually, if you're fortunate, right? You're like, okay, I know I have to do these treatments. I have to do this surgery. Then I have this treatment. And every day you're looking forward to the next thing you have to do. You may feel miserable, but you know what you have to do. And then, and again, this is if you're fortunate enough to kind of reach the end of your treatment and they're saying, well, you're cancer free, or there's no evidence of disease, or you're in remission. It's like you're at this pinnacle, the top of the mountain, but you have to get down the other side, and you never really thought about that part. You're just there. And of course, everybody's really happy because this is where you want to be, and you feel like you should be lucky. But there's a lot of dissonance around it, because everything that you powered through for the past number of months, I guess it just kind of catches up.
Yeah.
And for me, it was like I just shut down for a while, and I stopped. I couldn't write my blog, and I kind of lost my voice for that. And I got really anxious, and I developed a lot of panic. And I wanted to, now that I've kind of come through all that, I think it's important to talk about it, because it's a period of time when people need support. And there is a program that the Cancer Care Center has called, I think it's called Lost in Transition.
Okay.
And it is there for people, I think, to make that transition. I wasn't aware of it at the time, maybe because I was outside of the Avalon. But I think when you're coming off of that active treatment, reaching out for help, whether it's through a program like that, or, you can connect with an oncology social worker through Eastern Health, or any other, I guess, mental health care professional. It gives you a place to process what you just went through, reframe it, figure out where to go from here, for me, I had to get in touch with my body and just learn how to live in my body and feel the feelings that I needed to feel. Physically, everything was different. So you're coming out of treatment and you might have 4 or 5 or 6 different things that you didn't expect to have, right?
Yeah.
And so for me, it was a period of time. It was a very important period of time.
Yeah.
And I woke up one day, not that long ago, and I thought, oh, I feel this like passive non-resistance in me now, where it's like, if I could get sick again. The possibility is there, but I'm going to live as if I'm not. Mm-hmm. And I didn't feel like that for a very long time. So when you're just coming out of treatment and you're thinking recurrence is a possibility, you don't want to burden your loved ones with that. So it's important to find somebody to talk to if you can and get support. It's a hard time.
It is. It is.
Mm-hmm.
So you can share a few things you learned through your own cancer experience and as a member of this public interest group in cancer research.
So I learned about the immense capacity that we have to heal through my own experience. I learned about recognizing that your body and your mind and your spirit, it's all one thing, right? Mm-hmm. We tend to be up in our heads all the time, but it wasn't until I got really back into my body and learned how to feel everything through my body again that I could see that I was healing and feeling better and healing from the inside out. So I guess just a sense of being a whole person is what I learned, coming out of this. Like, we can be wounded, we can have scars and all kinds of things, but we can still be a whole person, and we have all kinds of power to do things. And we have power to do things that might be small, but they're big. And I feel that when I'm in the meetings with SevTap and all the other members of the public interest group, because we all bring different cancer experiences to the table. But everyone in that room, patients, caregivers, researchers, people who work with cancer patients, we've all been touched by it. And so we all have different perspectives. And when we come together, the conversations are just so great. And we always come up with new things that we can do to make things better for the next people.
Yes.
And that's what it's all about, right? We're always learning from what we went through and trying to make it better for the next group.
That's right. Well, that's a good use of what your horrible experience was able to help other people. And that's just a beautiful way to make something good out of something that's really unfortunate. Now, anybody listening might have been really intrigued by your story. It was really nice of you to share it all, but do you have any last words that you want to share with our listeners before we close off?
Yes, I do. Okay. If you are 50 or older, you can register for the colon cancer screening program through Eastern Health right on the webpage, or you can call them, email them. That just involves fit tests that you can do at home and then access to colonoscopies if you need them. If you're under 50, remember that the signs and symptoms of colorectal cancer are abdominal pain, cramping, bloating, pelvic pain, tenderness, fatigue, changes in bowel habits, narrow stool, and blood in your stool, even if it's bright red, contrary to popular opinion. So check your poo, everybody.
Yeah, it's wild, but that's a key to a lot of parts of our body. I recently did a microbiome test where they had to sample that way too. So listen, it does tell us a lot what's going on inside of our body. Thank you so much for taking the time today, Janine. I really appreciate you coming by and sharing your story with us.
No problem. Thanks for having me.
Thank you to our guests for joining me today. A resounding message comes through whenever we talk about cancer risk here in our province. Early detection and screening are critical for catching it early and improving outcomes. Patient advocacy and playing an active role in your treatment, as well as reducing risk factors related to lifestyle, are also themes which always emerge. These are things that we can do to improve our chances. With almost 1 in 2 Canadians developing cancer in our lifetime, it's something we should all keep in mind, and adopting a mindset around health will offer protection from many of the other health challenges we face in our life as well. Well, thanks for joining me today. I'm your host, Dr. Mike Wall. We'll see you back here next week for another episode of The Wall Show on your VOCM.